Good afternoon, everybody. I'm honored to be here today on behalf of Secretary Lourdes Padilla and the Maryland Department of Human Services to share with you some of Maryland's story about using performance measures to promote economic mobility. I want to thank ASPE and the Institute for Research on Poverty for hosting the panel and for inviting us to join. And I want to thank all of the attendees for your time and your interest. I'm privileged to serve as Maryland's first ever two-generation program officer. So what I'm going to do is frame my presentation in lessons learned through a process of implementing a statewide two-gen approach that intentionally coordinates and aligns state efforts to promote the whole family's economic security as well as their overall well-being. So I'm sure that this audience is quite familiar with the two-generation approach. So I'm going to briefly share our vision statement for what a two-generation approach means for Maryland, which is a coordinated system that is designed to work with families that are experiencing poverty so that both parents and children thrive. So the first step in our process was examining what data we had been collecting and asking ourselves what we might be missing. In the context of emerging research and practices, were we still asking the right questions about the families that we serve? And for over 20 years, Maryland has been a leader in shared performance measures across state agencies through our work with the Children's Cabinet, which collectively reports and shares results and indicators of child well-being on adult employment. Excuse me, I'm reading ahead. Let me slow down. But as we collectively report and share results and indicators of child well-being. But as new understandings began to emerge about the direct impact of children's health and well-being on adult employment and economic security, it became evident that we needed to start asking more questions about the links between our child indicators and our parent indicators and measure how our efforts in one area might influence our outcomes in another. And these questions were challenging because traditionally our systems have not looked at participants as parents or as children, but as individuals. So Governor Larry Hogan's administration engaged the University of Maryland School of Social Work to create a new data point measuring multi-generational poverty. And the University of Maryland archives all data on Maryland's cash assistance programs dating back to 1995. So the researchers were able to do data matching to determine an approximation of how many current cash assistance customers were also receiving assistance as children. And the administration was surprised to learn that more than 40% of current recipients had also received assistance as children. And further, when that data was disaggregated, there was a substantially disproportionate impact on Black children and a sizably disproportionate impact on Hispanic and Latino children. And because Maryland is a relatively wealthy and well-resourced state with a very low rate of child and adult poverty, it is all the more imperative that we're asking the right questions about the populations that we're working with. In March of 2017, Governor Hogan issued an executive order establishing a commission to study the two-generation approach and to make recommendations about where to go next. The commission was chaired by Lieutenant Governor Boyd Rutherford, and the whole family approach became the centerpiece of his policy agenda. I can't say enough about the impact of executive leadership on articulating the urgency and legitimacy of using the two-generation approach to serve families. Adopting a statewide whole family approach requires overhauling our data systems, adapting our programs, rethinking our staffing, and even examining some of our values. We couldn't have started that process with any effectiveness without the vision and commitment of leadership to make it happen. Interagency performance measures don't happen without shared accountability and buy-in. Shared accountability started from the beginning in Maryland with a commission that included state and local agencies, community-based organizations, members of the state legislature, and members of the public. Maryland sent teams of interagency leaders to other states to see what a developed two-generation approach could look like, to ask questions and to start thinking together about what successful outcomes look like. The commission also started its own two-generation pilot programs to test some of these initial ideas on a smaller scale. Ultimately, the commission agreed to adopt a statewide two-generation approach, and following the sunset of the commission, continued with interagency, state, local, and public-private two-generation efforts. And you can see a few examples of those efforts on the slide. Intentionally including the perspectives of families who are currently or previously received services makes for better policy, more effective programming, and makes sure that we're asking the right questions that shape our performance measures. Asking families what they think successful performance looks like can yield really rich results. There are lots of ways that Maryland is doing this, and I'd like to quickly highlight some. We conducted qualitative interviews as part of our initial pilot programs, and talking with participants directly about what helped their entire family get where they wanted to be has informed what measures of success look like for us. We want to make sure that our outcomes capture what really makes a difference for families, and the best way to know is to ask, because our families are experts and they often know our systems inside and out. I also want to highlight a more long-term effort to incorporate lived experience into our decision-making. At the Maryland Department of Human Services, we have created a professional career pathway for parents in our TANF programs to obtain work experience within our agency that often leads to contractual or full-time positions in state and local government. The WEX internship program has already produced numerous full-time staff who work closely with agency leadership and will be our next generation of leaders. Since my position was created about 1 year ago, the state has required performance measures specific to the 2-gen approach as part of a number of state agency plans, local department agreements, and vendor contracts. One valuable suggestion that we borrowed from our friends in Colorado was that at the beginning we would place just as much emphasis on process measures as we would with program measures. Ultimately, everything that we do is to create better outcomes for Maryland's families, but we're also making a really big cultural shift in how our agencies achieve that. So we want to measure how well we're working with partners, training our staff, and incorporating family voice. So I've listed on the screen some examples of actual program and process measures that we've developed. By aggressively achieving our process targets, we'll see a concomitant improvement in our traditional individual performance measures like the work performance rate, as well as a reduction in the number of children experiencing poverty who grow up to be adults experiencing poverty. Thank you for the opportunity to share, and I look forward to continuing this discussion in a moment.
Thanks so much, Christina. I'm going to hand it over to Tracy Gruber, who's based in Utah. She's the Senior Advisor for the Utah Intergenerational Poverty Initiative.
Well, thank you so much for the opportunity to be here today. I'm excited to provide an overview of Utah's Intergenerational Poverty Initiative that started in 2012, and it'll serve as a very brief case study for how data is integrated to inform decision-making and to measure outcomes for families experiencing intergenerational poverty. And it's not very much unlike the presentation from Maryland. And in this brief period of time, I'll provide an overview, understanding the issue through data across agencies, how we use the data to establish goals and measure outcomes. As I mentioned, Utah's Intergenerational Poverty Initiative was established by state law in 2012. It's kid-focused, meaning that we look at the outcomes for the children and measure the data from their perspective. It requires using data across multiple state agencies and the establishment of 5- and 10-year goals. It requires extensive coordination to understand what's happening in child well-being of children experiencing intergenerational poverty, from their educational experiences and outcomes, the workforce engagement of their parents and the family's income and financial stability from housing on up. It includes data from child welfare in the juvenile justice system and health. And it requires us to use this data annually to evaluate where we're going next. So before Utah started this, or at the time that it started this process, it had to define what it meant by intergenerational poverty, not just by law, so not just the language of intergenerational poverty, but how were we going to measure it. And as a result, our state has established a definition, not unlike Maryland's, of usage of certain public assistance programs that most closely align with poverty as adults for at least 12 months, and then also those adults' usage of those public assistance programs as children for at least 12 months. And when this first started, we pulled that data together, and this is data from last year's report. So as I said, we do this every year, but roughly about a quarter of Utah's population that relies on those certain public assistance programs. It's anywhere from a quarter to 28% on the high end. This diagram just shows who we're talking about in our data. And this is just primarily data from the department that I work in, the Department of Workforce Services. And then we use this group of individuals to match with our other data sharing partners. So 28% in the data last year of the adults were in used public assistance programs as children and are still using them in 2019. And then that lower bar of the 156,000 and the 53,000 are children. The 156 reflects children of parents who aren't in intergenerational poverty based on data, and the 53,000 is kids. So once we established the definition and we got a better understanding of the experiences in the population, we then matched to decide to evaluate the child well-being situation and establish those 5- and 10-year goals that are required by law across these 4 domains of child well-being. And I know that this is very hard to read, and I apologize for that. In each domain of child well-being, you have a 5-year goal and a 10-year goal, and because we're looking across those areas of child well-being, we're data matching with multiple state agencies. So we data match to get child welfare data. We get not only the child, but the adults' child welfare data, academic outcomes for the children, higher ed enrollment for the parents, wage earnings, engagement with the labor force, so how many quarters have the parents been employed, and then of course health data from birth through adulthood. Are they going to the doctor on a regular basis? Are they seeing a dentist on a regular basis? Where do we have shortages of healthcare providers, where we have high rates of intergenerational poverty? And the relationship between economic mobility is that for the kids to be successful into adulthood and end the cycle of poverty, they need to be in households where families are able to meet their basic needs. And just going back to the slide on family economic stability, which is really the focus of this conversation, we have a 5-year goal that we want to make sure our families are able to meet the basic needs of their kids, regardless of that, if that is through public assistance. But by 10 years, we really want the families to be self-reliant, self-sufficient, however you want to phrase it. So in order to meet those family economic stability goals, of course, we have to be looking at data across the system to see if we're making progress. And that's where we come to the annual data reports that we produce every September. So stay tuned. We're in the process of finalizing our current one. It'll be due to the legislature in Utah by October 1st. And by having that requirement that we're looking at the data all the time, we can kind of see whether or not the population of families experiencing intergenerational poverty are moving in concert with maybe current economic conditions, if they're lagging behind. And in Utah, we've had some pretty significant economic growth until the pandemic. And it was very interesting to be able to look at our intergenerational poverty data every year to see if they, in fact, we're making progress along with the economic conditions. And for some, they were, and that means that we didn't see them in our data, these families in our data the following year. But for others, I think what we saw is that the strong economy that Utah was experiencing was still leaving behind a lot of these families that have multi-generational poverty. So the ability to look at the data every year, to have it be cross-sector, so we're looking at the early childhood outcomes from kindergarten readiness scores to 3rd grade reading proficiency to math math proficiency to the outcomes for their parents, that then allows the commission that is established in Utah, the Intergenerational Welfare Reform Commission, to evaluate outcomes and progress. And the data that we are coordinating for, which does require MOUs and data sharing agreements with our other agency partners, is not only used at the state level, but we also have an initiative where our counties that have disproportionate rates of children experiencing intergenerational poverty are able to access that data and then utilize that data for their own county level plans, which has been incredibly valuable, recognizing that states or the federal government is not going to be able to end the cycle of poverty without the involvement of local communities. So we want our data to be utilized, we want it to be meaningful, and that's what the Intergenerational Poverty Initiative is all about. And I look forward to the additional conversation and hearing from the other panelists about their experiences in this area. Thanks so much.
Tracy, thank you for that. We're going to head on over to Washington State. We have David Mancuso presenting. He's the Director of the Research and Data Analysis Division within Washington State's Department of Social and Health Services. David, I think you might be on mute.
Yes, thank you for that. And thank you for the opportunity to present some of the work that we've been doing that touches on themes of economic mobility and economic outcomes. This work flows out of the integrated data environment that we've built in Washington State. And, this is, I'm sorry, there's a slide that's missing there, but so this is work that is built out of our integrated data environment here. We do integrate data from our main health and human service IT systems that support food and cash and medical assistance, and we integrate that data longitudinally at the individual level with other sources that are important for understanding family relationships and outcomes experienced by folks served by the main health and human service programs that states administer, generally in partnership with the federal government. This includes vital records, births for family linkages, deaths, criminal justice data, unemployment insurance, wage system data. And we do quite a lot with this integrated data, and that's what the next slide speaks at a high level to. I encourage folks who have an interest in taking a deeper dive into what we do to explore our website, where you'll find hundreds of policy briefs and research reports and other content that we published over a few decades to investigate policy-relevant research questions in a state agency environment. To give a sense of our size, we have roughly 125 staff, roughly 100 of whom are funded through soft money, not a core appropriation. So we really operate as a pretty large research enterprise, analytic enterprise really, since most of what we do wouldn't be considered research technically, in a state agency environment. We have a few dozen folks with PhD level background in the quantitative social sciences, data management staff. We have a survey research unit, and other components. So let's keep moving in the interest of time. This next slide, please don't attempt to read it. It's really meant to illustrate the overlap between the three largest agencies in our state that administer most of what we think of as health and human services programs. On the one hand, the Medicaid program that's responsible for most of Medicaid, our agency, which is responsible for the rest of Medicaid, as well as food and cash assistance and some other programs, and the agency that's responsible for child welfare, early learning, and some juvenile justice programs. And it's really meant to show the extent to which there is significant overlap across these agencies, which really speaks to why we do data integration. We're not doing this because we have an intellectual or academic interest in these relationships. It's really critical for the work of the agencies that we support, because integrated data can say a lot about risk factors, about need for services, about outcomes experienced by what is largely a shared population across these programs. And where we have people in these areas of overlap, we're often talking about folks, families, individuals who tend to be at the higher end of the risk scale, with needs certainly in multiple areas. All right, so I'm going to close by illustrating 3 analyses that connect to economic mobility, economic outcomes. The connection may seem slightly tenuous at first, but maybe not, given the discussion so far. But hopefully, as I get through these 3 beats, you'll see kind of the theme that we're bringing out here. So one of the things that we've done for the better part of a decade now is to use linked administrative data to build out measures of adverse childhood experiences. So these are concepts that were originally developed in survey-based literature, to my awareness, and many of which are amenable to measurement using linked administrative data. The experience of abuse or neglect, building family relationships through a variety of means, including linked birth records, but also case composition on public assistance cases. We can link parental experiences to the experiences of their children, parental substance abuse, parental criminal justice involvement. We also link in information about homelessness, mortality, domestic violence experiences that we can glean from administrative data. And this analysis that we're looking at here, the outcome that we're modeling is the chance that a child develops a substance use disorder in adolescence. And we're doing this analysis in a multivariate framework, so we're bringing in these administrative data proxies for adverse child experiences and seeing which of those are most strongly correlated with that adverse outcome of a child developing a substance use disorder by the time that they're 17. And we see that experience of child abuse and neglect is number 1 with a, I'll say with a bullet, probably a horrible metaphor, a horrible visual, in terms of the risk that it poses to the development of this type of significant behavioral health risk factor in children. These other outcomes are all impactful, all really important to understand. But this is the kind of modeling that we can do with linked administrative data. It helps highlight the critical importance of our child welfare agency working with our Medicaid agency. The Medicaid agency is responsible for behavioral health services for this population. The child welfare agency obviously has the lead role in addressing abuse and neglect, including early intervention programs. So moving the story forward and thinking about the economic mobility theme, we have had intermittent ability to link to educational data. It's one of the challenges we still have, even with the scale of data integration that we do. We can relate educational outcomes for youth served by public programs to behavioral health risk factors that we see for them in their adolescence. And that's what this chart does. We're relating on-time and late graduation rates among this large population of youth served by health and human service programs. You could think of this as food, cash, and Medicaid assistance, extended to include some other programs. And we see that youth who have no identified behavioral health risks, and in our state there are several 100,000 youth in this analysis here. It's one of the great things about administrative data. We have vast populations for whom these measurements are possible. We see that it's really youth with significant behavioral health risks that are among those with the greatest risk of adverse educational outcomes here measured by failing to graduate from high school. We move forward and we look at, well, let me maybe take a step back to that one. Obviously, educational outcomes are hugely impactful in terms of future economic outcomes for individuals, so that connection is probably quite obvious. If we move the story forward and look at adults on Medicaid, here adults age 18 to 64, and 3 outcome areas, do we see them as homeless? Again, using administrative data sources for broad populations. Do we see them arrested? Do we see them with employment through linked employment UI system wage data? We see a similar gradient of behavioral health risks driving adverse outcomes in our adult Medicaid population, whether that outcome is being homeless, arrested, or being able to gain and hold a job. And if we were looking at emergency department utilization or inpatient utilization in these populations, those charts would look just like what we see here for those who are homeless or arrested. And so we draw these analyses together. What we and just kind of skimming through these kind of three areas of work that we've done over the years, we see the importance of linked administrative data for being able to quantify some of the major areas of impact, the importance of childhood trauma, the importance of behavioral health risks in affecting economic outcomes for individuals. And obviously these risk factors and intervention in these areas are likely to be really important for improving economic outcomes for the populations that we serve. I'm going to close with just one last plug for folks who are interested in a deeper dive into these studies or any of the other things that we're doing to take a look at our website, and you'll find a constant flow of new analyses flowing out on these kinds of topics. Thank you.
Thanks so much, David. And next up, we have T.E. Powell from the state of Colorado. She is the Director of the Office of Economic Security within Colorado's Department of Human Services.
Hi, good morning. Can you hear me okay?
Yes, go ahead, Key.
Okay, great. Good afternoon, I think, everyone, depending on what time zone you're in. I'm T.E. Powell, and I'm the Director of the Office of Economic Security at the Colorado Department of Human Services. And I will go ahead and forward on these slides. It is worth noting that Colorado is a state-supervised, county-administered system, and we have 64 counties here in Colorado. In 2011, we engaged in developing a performance stat strategy here at the department, and the focus of my 6 or 8 minutes here today will be about the journey of using our federal metrics as a starting place and the lessons learned along the way to moving the needle. I think the former speakers did a really excellent job of talking about alignment of metrics maybe within a family or within a person's life. And the lens I'm going to be looking at today is maybe alignment of metrics across a variety of programs that are attempting to achieve similar things but are measured in different ways. So many of you may be familiar with the TANF program, and really the only federal metric that we are examining here with TANF across the nation is work participation rate. And this really looks at the kinds of activities that a TANF client might be engaged in. You can see here in Colorado we call TANF Colorado Works. And this was really our starting place about 9 years ago when we were looking at how we were going to measure our performance in the TANF program. We started with the data we had on hand and what was required, and for us that was work participation rate. It's nice to note here that you're seeing the most recent data, but if we were to look back all the way to 2011, we were performing in the low 9 to 11%. And have made significant strides over the last 8 years in improving this metric. And we'll talk a little bit about how we've done that. So moving to this next slide, like I said, we really want to build off of regulatory measures like work participation rate, but use this as like a launching pad or a starting off point for the outcomes that we hope to see our families achieve. And for us here in Colorado, one of the ways that we did that was to begin looking at the types of activities that clients were engaged in. And we really wanted to encourage clients to be engaged in work-based learning activities and not necessarily activities that we didn't think would help them become employed or further their education. So, that's a conversation, right? It's a conversation with us, with counties, with clients about what really matters to clients, what really will get them to economic stability or self-sufficiency, and then begin defining that. So in these ways, the metrics that you're looking at now are not federally prescribed. They're things that we came up with on our own in collaboration with other parties, but we think they're the right things to be measuring for families. I want to further, I think Christina made this statement that it's totally fine to start with outputs or process measures, and we here in Colorado would absolutely agree with that statement. You got to start somewhere, And outcome measures tend to be longer, right? So knowing that somebody actually became employed might be something that would take you a year to find out, whereas noting that they are engaged in the right kinds of activities to gain employment is something we can know today. So we often recommend starting with process measures where available, and we believe that those can ultimately lead to the right outcomes. I did want to note here that the work-based learning activities are really what we would call a lead measure. If you're familiar with the 4 disciplines of execution, that language of lead and lag measures is something we use here in Colorado. This is an example of how engaged in work-based learning activities can ultimately lead to entering employment. Again, this is not a federal metric that we are looking at nationally, but it is something important to us here in Colorado, and so we developed in our data system the ability to track our clients over time and see that when they are exiting the program, that they are exiting to employment. You can see that this is live data. It's something we look at on a monthly basis. And you can also see when March 2020 hit, where we began experiencing the global pandemic, where our employment rates drastically decreased. This year looking at cumulatively, but if we were looking at it month over month, we saw our employment outcomes cut in about half for these clients. I did want to note that part of this conversation was about alignment of metrics, and I think it's really worth us continuing to have a conversation and advocate at the federal level for us to have alignment of metrics across programs. Refugee Services is another program that falls under my purview, and the employment outcomes that we look out there that are federally prescribed are fundamentally different than those in the TANF program, as well as in our SNAP employment and training, or the employment arm of the SNAP program. For Refugee Services, there are federal measures that are about entering in employment, about sustaining employment. In Colorado, we've built off of those federal metrics and also begun looking at things like wages, because we believe that not only getting a person a job, but having them sustain the job and then having a job that's a livable wage is critical to ensuring economic stability. So that's one little plug I think I'd have, which is we need to continue to align the way that we're measuring the effectiveness of employment across our programs. The reason I want to use this slide, though, is that when we go to the next slide, I think one of the most important lessons we have learned here in Colorado when we're trying to move the needle is actually breaking our data out by meaningful unit of analysis. And that can be lots of things for lots of different states, including looking at data by contractor, by county, by regional office, by supervisor, by worker. You'll see here on this slide that this is the exact same data you were looking at on the previous slide, except it is broken out by contractor. So in Colorado, our refugee services are actually provided by 3 separate contractors. And here we can see that the story is completely different. Focusing our strategies on how to move the needle at the statewide level can look very different when you break it out. Sometimes we have data that I say looks like a beautiful synchronized swimming, which means that all the contractors or all the counties are moving together. And that probably tells us something about our strategy, that it might need to be more statewide. When we look at data in this way and we see it broken out by contractor and the real variance in performance, I think that tells us something different about how we might want to move the needle here. Finally, it's worth noting that there are a lot of things we do, right, that are not federally measured. And there are real opportunities for innovation, and that shouldn't stop us from trying to measure outcomes and learn from those opportunities. In Colorado, we've invested in a number of employment programs, including what we call subsidized training and employment, and we don't have statewide data. So our best tools here are program evaluation and research. But it's okay, that's a starting place, and it's a place for us to kind of jump in. And with that, those are the last lessons I wanted to share, but really just encourage you to reach out if you have any questions. and happy to answer any questions. Thanks.
Thanks so much, Ki, and to the rest of the presenters. I'm going to try and transition us into our Q&A session here. So I want to start with a couple of questions aimed at the states and hopefully kind of widen the lens of the conversation to the federal level in a more coordinated effort. But for any of the speakers, and specifically Christina, you mentioned conducting interviews with families or other beneficiaries. Can you all talk about how you chose your indicators and outcome measures and the role of beneficiary voice in that process? And Christina, if you want to start, and then if others have, they can chime in.
Sorry, I'm getting situated here. Yeah, I'm going to answer that in a couple of ways. I think I saw the question about how interviews with families and qualitative information is informing our measures and our data. And I think, so really directly, informally right now, but formally moving forward, I want to put in a plug for our P10 work group. We have a work group that has started within our Family Investment Administration that is working on how we set performance measures for our TANF program. And they are actually looking right now at aligning those performance measures with some of our WIOA work, but also with some of the information that we've been getting directly from families. And so as I'm actually waiting right now on another qualitative round of interviews, I have a work group of state and local agencies that are coming together to work on those performance measures. And so I have a place where I can sort of bring those to better inform that conversation as they're doing that work. Looking forward, I want to put in a plug. We're actually in the middle of a really radical transformation of our data integration at the state of Maryland. We're working on what we're calling Maryland's Total Human Services Integrated Network, or the MDThink project, which is data sharing, cloud-based data sharing for state agencies. And so one of the things that I've been working on through that process is sort of creating a mechanism by which we can capture the things that families are asking for that we may not be providing in their jurisdiction. So what is the mechanism for capturing if they're looking for a specific service and it's not offered in their zip code or in their community, how are we able to capture that? And so really trying to bake that aspect of family voice into our service delivery moving forward.
Thanks, Christina. Anyone else want to chime in on beneficiary voice?
I'll jump in just in terms of the first part of the question, which was how do we come up with our indicators? Most of our performance measures and outcome measures are tied to what the research says is most closely aligned with child outcomes and child well-being in the long term. So we tied our outcome measures to that research base. But in terms of bringing in the voice of the families that are utilizing services throughout the state, we have some researchers up at the University of Utah who've been doing our TANF program is called the Family Employment Program, kind of like probably the comparable to Colorado Works. And we do these WAVE studies. They're called the FEP, Family Employment Program WAVE studies, where utilizers of those services are interviewed extensively. And that kind of also gets not only to the outcomes for the program itself, but also for intergenerational poverty. So that's how we're doing it. And then in terms of health, there's like these behavior surveys, behavioral risk factor surveillance surveys, I think they're called, the BRFIS, at the Department of Health. So you're getting some of that qualitative data in as well. And so we're combining kind of the quantitative and the qualitative in that way here in Utah.
David or Key, before I move on to the next question, any thoughts? Or not to put you on the spot, but go ahead.
Just quickly in Washington State, we do survey extensively both a biennial large-scale client survey across most health and human service programs, but also we're running more than 100 smaller surveys in a typical year as well. That would be the way that we most commonly get feedback from clients about their experiences.
Great. And David, maybe I'll piggyback for the next question. There was a question around client consent and beneficiary consent, and whether, you need to get that to link administrative data. And I think that applies to all the states here. So we'd love to hear your processes and your state's thinking around, data privacy and consent overall.
So in some contexts, that's absolutely critical. To give an example, our ability to link information from our homeless management information system depends on individual clients who sign consents for the data to be integrated into our environment. About 85% do. There are other contexts where the foundational legal authority allows information to be shared more freely. But this is a fundamental issue. Underlying our data integration work, there's a large raft of data sharing agreements that connect to the underlying federal and state statutory and regulatory environment that govern what we can and can't do with data.
Any other folks want to chime in here?
I'll jump in again. So yeah, in terms of integrating, kind of combining the data with our data sharing agreements, since most of our data is aggregated data, we don't have to get the consent because we're not sharing personal identifiable information. I think when you're transitioning from using the data to inform policies and rule changes to actually serving the families, and we need to let our partners and some other agencies who the families are that are working with us, we do have to get consents from the families. So if we have a family that's in our TANF program that they also have a child welfare case, and they have a case manager over there, but they need to know what's going on with their workforce plan, we would have to get consent to the family. And we do have a lot of frustrations at the local level that we can't just give the list of names of individuals that we're using in our annual reports to understand what's going on holistically in intergenerational poverty, that we can't just pass those names off to the counties without the consent of the families.
Great, thanks, Tracy. The next question is actually for you. There's a question around what you have learned so far, given all your years of experience, especially using the predictive analytics. Great question. I think in terms of what's happening with the families, again, I think what we've seen with the strong economy, and our data this year, the report that's coming out I mentioned, does not include the impact of the pandemic. So our data is a year behind. I think what's been super interesting is, one, the families that are obviously still in our system, still showing up as experiencing intergenerational poverty, have higher rates of unemployment and less attachment to the labor force, have lower levels of educational attainment. I don't think that that's any big surprise. I think it's much harder for these families to engage in the labor force and maintain engagement. But on the kids side, since we've done so many changes to policies around education and made investments in things like high quality preschool and full-day kindergarten, we're seeing improvements in those measures. And our graduation rate for children experiencing intergenerational poverty, that gap has really tightened. I think the other thing that we've learned is that, and there was a question in the chat about this, there is a relationship between childhood trauma and kind of intergenerational poverty and intergenerational childhood trauma. A lot of our families have high rates of abuse and neglect, as the parents have high rates when they were children, and we're seeing that in the children as well. So those types of things are really hard to change. But it's led to more investments in behavioral health services and resiliency and those types of factors that we know will move the needle and improve outcomes in the long term. Great, thank you. So I want to transition us a little bit to the linkages now between all the great work you all are doing in your states to any kind of coordinated action at the federal level, which is what this whole conversation is about. And I want to start with a very broad question just around, from your vantage point, given your experiences within your states, what would you want from the federal government to support your efforts to fill some of these data gaps?
I'm happy to kick that off. And can you hear me okay?
Yes, go ahead.
Thanks. You know, I always say that every policy or every outcome that's been created at a federal, state level has a value or philosophy behind it. And so I think it's really healthy for us to examine what that value or that philosophy is, and really determine if that's aligned with what the clients would say their value or their philosophy is. For instance, when we look at work participation rate, you know, why are we looking at that? What does that help us learn about our system? What does it help us achieve for our clients? And I think if we were to sit down with clients that are in the TANF program, they might say that that is not aligned with the outcomes that they hope to achieve as individuals. So I really think a healthy dialogue about examining across our programs what the motivation is for those metrics, and if they're actually aligned with what clients are hoping to achieve would be a really great starting place for us.
And this is David. I attempted to jump in there and just echo, I think those are great points. The most important measurement that we do is generally through analytical work in many areas. I don't want to speak to all areas, but it's really work done on a separate track from meeting our federal requirements related to standard metrics, because that measurement approach is not without enhancement, elaboration. Those measures are not directly going to tell us what we want to know about impacts of programs or contractors. It may tell us about a level of outcome, but it doesn't help us understand the why, and even, you know, the who. If we're talking about contractors or regions, the who's doing well, because it doesn't, typically it's not accounting for other things that could be driving that variation.
Thank you, David. So I wanted to ask each of you, how do you balance your federal reporting requirements with your own state's goals? I heard a number of folks on the call mention that this is not a federally required, data indicator that we're tracking. It's something that we've decided as a state is important to us. So can you talk about that balance? And I think connecting it to the bigger picture, oftentimes what I hear from state-level employees is that if we want to do anything at the federal level, we have to mandate data reporting back from the states to the federal side. And could you talk about if having a shared definition at the federal level that you all might be aligned to, whether it's for funding purposes or others, do you think that would help your efforts or hamper them in any way?
This is Key. Happy to take that one or kick it off. I think there are a couple questions in there. First off, I think, like anything, if you're measuring more than one thing, then, you're focused on more than one thing. And so we do have to be cautious about that. We're required to measure the things we're required to measure. And so obviously, I think all states are going to move forward with that and do that. We have had issues in Colorado and conversations with contractors or counties where they feel like they're competing demands. So federal guidance says we have to do this one thing, and we're going to be held to that standard, and also we want to do this other thing. I think you continue to work through those conversations and not overload yourself with metrics, but really try to balance what you're regulatorily required to do and also what we think are the right outcomes for individuals. I think we're always trying to, I think you heard that across all four of us, we're all trying to balance that. I think separate from that, your last question, and I think I'm maybe forgetting what that was, so I'll either kick it over to someone else or you'll have to repeat it.
The latter part was just, do you think having a shared definition at the federal level would help for this, state-federal interaction that we're going to have? I think we envision we'll need to have a coordinated effort at the federal level.
Yeah, thank you for prompting me on that again. I may not fully be understanding the question, because by shared, I think having worked in a variety of human services programs, I think there's what could be shared across programs. So is food assistance, is TANF, is refugee services, all looking at employment in the same way. I also know that we struggle nationally with how we interpret that definition at the federal level across all of the states. So I agree that having a shared definition across programs, across states can kind of all help us row in the right direction. I will say my experience tells me that oftentimes that is harder to realize than we imagine, but it's always worth continuing to strive for.
This is David.
I want to talk about balancing different reporting requirements.
Oh, sorry, I stepped over that. Maybe just, so I'll just follow up on the point I was going to make. I do think that the required reporting that we do, I think it's really important for a variety of reasons, but it's always going to be fraught with challenges, especially in drawing out cross-state comparisons in performance. And that is true because of the variation in the way states have designed policies and programs in the common set of programs that we operate. I think this is most transparent in the healthcare setting where there's, I think, the most richly elaborated quality and outcome measurement infrastructure that's related to managed care reporting. There are manuals about how you define things. There's standardization of healthcare data under HIPAA. And yet cross-state comparisons that attempt to look at performance are fraught because some states are expansion states, others aren't. The case mix that we're serving through our Medicaid programs can be vastly different. And those issues are, to some degree or another, and other issues would present challenges in other measurement areas before you even get under the hood of how states are on the ground doing reporting to a common file template, that kind of thing. So I'll pause on that.
Tracy and Christina, any comments there?
Yeah, I'll just affirm what Kate said. We've had similar conversations with vendors and with other partners about, okay, if we add additional measures, does that mean that the federal measures are going away? And we just have these conversations often where we say the federal measures are not going anywhere. The federal measures are still very important. We're adding additional measures. And what we've tried to do is sort of draw the line between if we add the additional measures, then the federal measures should also improve. And so we try to keep it together that way so that we're not overloading people with additional measures, but it is a tension. It is a tension between the performance measures and then the new evaluation that we'd also like to do.
Christina, that's a great segue into my next kind of balancing act question, which was the tension between measurement for sort of long-term evaluation or longer-term outcomes that we're interested in versus, shorter-term and more highly frequent reporting and transparency requirements. Can you talk about that, and then we'll ask other folks to chime in as well?
Sure. So that's something that we're looking to build on as we're talking about our shared services. It is a tension. It's a real tension between what we have to do and what we want to do to deepen that. But I think, like I said, we're just trying to draw a line between the process measure and bring in the process measure as a way to sort of enhance the performance measure, which may work, it may not work, but really bringing in, and again, trying not to overload as we want to do these evaluations, to be really intentional about what measures we do want to include so that we're not overloading people and everybody really understands the context for what we're trying to do.
I'll also add that it's not just a tension. I feel like from our side, I kind of say like we're doing research to inform policymakers so that they can kind of have a high level understanding of what's going on and then come up with policy solutions. But there's also a tension between academic researchers and the research that we're doing to inform policymakers, as well as kind of the tension on the output. I think you guys, you call them performance measures and process measures. We in Utah call them output measures or outcome measures. I don't know if they're the same thing, but again, there's the issue with not having a common language. and the administrative data that we're reporting on at the federal level is more that output information. How many people, do they have jobs? It's less about what we would say is the higher level outcome measure of whether or not people are better off. So you've got kind of three competing uses of the data, from the academic researchers who are looking, at RCTs and needing super clean data and variables and the complexities involved with that, and they're producing reports that are very important but very difficult for policymakers to kind of digest and make informed policy decisions with. Then you have our report, which is pretty much just basic quantitative data, how are families doing generally, and then the administrative data that we're required to report at the federal level. And across all of those, you have to define the purpose of the data, why it's being used, and who the audience is, so there's clear understanding about the purpose of why you're collecting it and utilizing it.
All right, thank you all. I want to kind of shift over then to lessons that might have been learned from your efforts. So what do you feel are your most important takeaways as we talk about a potential federal effort? And I'll let anyone who wants to volunteer sort of kick us off.
I'll jump in. I think in terms of effective use of data in a state agency environment, the most critical resource are skilled analysts. And I think in terms of value, so maybe kind of setting aside the federal effort side, the value on the state side would be efforts that could catalyze states to further build out teams of staff with analytic capability, or build partnerships with academic partners who can bring that analytic skill. This is, most states are in a data-rich environment, and there's the legal authority to share much of what states would have ambitions of sharing. There is challenge in building consensus and comfort, and some of that challenge connects back to the ability of agency staff to make effective use of somebody else's data. And much of our success in growing this capability has been based on deep investment in staff with analytic capability, building partnerships with subject matter experts in the agency environment that help ensure that we do more good than harm with really complex data that's changing all the time, derived from IT systems that were not designed for analytics, but designed to do the business of social health services. So I would put a plug in for any initiative that helps foster state agency access to skilled analysts, whether that's helping them build teams internally, or, which is my bias, since that's how we do it, or building partnerships with external entities that are really focused on meeting their needs as opposed to other needs. And there are a few different types of those that present risks, but I'll leave it there.
I can chime in with a few things on lessons learned. I mean, first, I think that there's no perfect data, and people are always trying to find the perfect measures. And I think, like he said, you have to just start somewhere, and you start with what you have. And people want more data. We need this indicator, we need that data indicator, and you can get bogged down with some of that. So there's no perfect data. I think that it's also one thing that I've personally learned as I've been reporting on data now for 6 years in Utah, is that there's people behind the data, and the data doesn't tell you everything. So I think you always have to kind of combine the data with what's actually going on with the individuals that the data reflects, and understand what the data is saying. And then lastly, like, use the data. It does nobody any good to have lots and lots of data being collected. And I think that it's really interesting that between the four of us, we kind of are doing similar things, right? I mean, we've understood that these output measures are not enough to really understand what's going on with families, that we have to look at the family as a unit and comprehensively. We have to look at their kids. We have to look at the pathway of the kids. We have to look at the adults. And then we have to use the data. And a lot of the data that we're collecting for the federal reporting, quite honestly, is not useful in that regard, just to put a finer point on what others are saying. So we want data to be not only collected for the sake of collecting it and checking the black box of how many people we're serving, but we want to be able to use it and use it to better the lives of the families that we're serving.
Anyone else, or should I jump to the next one? All right, I do want to pick up on that theme of lessons learned and talk about some of the biggest barriers to the type of analysis we're talking about. One is, I think, generally still legal barriers to data sharing, and even if there isn't an actual legal barrier, some of the conversations I hear sometimes are around perceived legal barriers. So just a general kind of mindset from the legal side of different agencies, whether that's at the federal or state level, and then resourcing around funding these types of efforts. So I'd be curious to hear lessons learned from your perspective at the state level, how you've tackled two of these big issues, and if there's anything that you might generalize to a potential federal level effort.
Yeah, this is Key. Happy to address that a bit. I would say my experience is that some of this is perception, but a lot of it isn't. When you're talking about all of the federal programs that we've mentioned today, between child welfare, food assistance, TANF, refugee services, et cetera, much of that data is actually prescribed by the federal government, as being confidential, as it should be. And I had a very research mindset when I was younger, and now, as a person who helps administer these programs, I have a much greater respect for why I think a lot of that data should be confidential at an individual level. What it doesn't, preclude us from doing, which many of my co-presenters talked about, is de-identifying that data and still using it to learn really important things about our programs or the people that we're serving. To that end, I think all of us are involved in those efforts. There's been a real push, I know, over the last 10 years for interoperability among these different systems. So when I think about, again, Colorado being a state supervised county administered system, at the county level, a county worker being able to, understand what all the families involved in and accessing that data, we're still grappling through that because that's not allowed across all of the programs, all of the various data elements. There are some things that are allowable, and we've been working with our federal partners to be able to provide that level of information, but the detail level is often, not as available. And I don't know, I think that there are good cautions in place and things that we just have to continue to grapple with because there's no perfect answer here.
I would add that one of the big challenges in many of the states that we've talked to who kind of are considering embarking on a similar effort is that they have outdated data systems. I mean, just from a purely technological standpoint, they don't have the systems that can share the de-identified information, do kind of sophisticated matching queries to make sure you're talking about the same individual across programs. In our state, investments in technology has been kind of a priority, and that has allowed us to share. But a state could have the best intention and really want to embark on an effort like this, and you start talking to them and their data systems are just so outdated and there hasn't been kind of a prioritization on upgrading those systems, and there's just no possible way you can start matching across these programs.
I'd like to add a couple of areas where there are legal barriers, although one of them may be evolving. So 42 CFR Part 2 has been one of the more challenging areas that relates to substance use disorder service data, not all of it, but much of it. Although the recent CARES Act may be changing that to align it more closely with HIPAA, although I think we're still waiting for a rulemaking on that. In our state, FERPA, which affects access to education data, is perhaps the largest remaining barrier to the kind of data sharing that we're doing in other areas. I suspect other states are doing that more effectively than we are, and it may be more idiosyncratic to who we have on the beat in the Attorney General's office around the topic. But that gets kind of in the direction of, maybe I'll kind of skip over that, but trust among agencies and trust among constantly evolving leadership of agencies who own the data that we work with, most of which is owned by external partners, not part of our department. That's critical. We found it to be critical for this kind of effort to succeed over a period of decades. And that trust is built on doing good work with the data. It goes back to being an effective analyst or an organization that effectively analyzes data, produces value that's broadly perceived. So in many ways, I think it goes back to doing good quality analytic work and building from some smaller core, building out support among more and more partners in our environment to join into that effort.
Thanks for that, David. There's one more question that I wanted to get to that relates back to your own efforts within your states and talking about how your integrated data has affected your relationships, not just with your contracted partners, but maybe advocacy partners. And I understand that could be kind of an open-ended question depending on how you interpret advocacy, but would love to hear how you all would interpret that and maybe just like one example of that type of relationship.
In many cases, our advocacy groups have close relationships with the state agency partners, and so it's not uncommon for advocacy organizations to be involved in new analytical work as it's being conceptualized. I guess I'll leave that one there.
Anyone else?
And this is key. Oh, go ahead. Someone else?
No, go ahead.
Oh, I was just going to say that, I think it depends on the nature of the relationship. I think if you're measuring, for instance, if we were looking at the slide that I demonstrated with the contractors, right, and we're measuring their performance, I think that obviously can lead to both opportunities for praise and lessons learned and sharing of best practices, and it can also lead to tensions if one contractor isn't performing where all others are. So I would say it's like, no different than being a supervisor of a staff member, right? You're going to have some good things and sometimes have some tough conversations, but, we're capable of doing that. In terms of integration with advocates, I would say it's been really wonderful to be able to demonstrate the kinds of outcomes that we're looking at, and oftentimes to use our data to work alongside our advocacy organizations to either promote policies or practices that we're really wanting to better our system or, make that for the client, but sometimes, our hands are tied, and advocates just, have a very different skill set than we do and can engage in that policy conversation, legislatively or in other types of forums that I think are not historically where we are necessarily, in that space. So I would say generally it's positive and a real opportunity for us.
Thanks, Kee. So I want to close off with a bit of a big picture kind of question. Kee, you mentioned in one of your comments about doing anything like this at the federal level or any level requires having a lot of clarity around your vision for why you're doing this work and sort of the values that drive that. So I wonder if you all could just close off with just sort of aspirational vision around what something like an effort like this at the federal level might look like, given that you've been steeped in this work in your states. What do you dream about at the federal level, knowing that, again, it might not all happen, but it's always good to have a big picture kind of goal as we get more into the practicalities of these conversations in later dates?
Yeah, I'm happy to kick that off. I would say, if the last 6 months or so, our world has totally, been flipped on its head. And in the measures that exist in terms of health, in terms of, other factors that have been going on, I think we've seen that there's a lot of inequity going on in our world and our systems, and also that that many of our systems were created, again, with some sort of value or philosophy, and we don't need to judge that. We just need to say that that's how they were created. And I think we need to examine if those philosophies or those values are indeed still held today, and if they actually support helping citizens across America be successful. And I think if that were my starting place, my big push would be, a little bit of going back to the drawing board, really including client voice in looking at our systems and therefore our outcomes, and ensuring that the systems that we've created are there to support the outcomes that we really believe they're supposed to be supporting, and then kind of push in that direction. I think there's been a real change in our world in really including client voice. And we could probably all agree that whenever these systems were created, we might not have been doing that. And if that's the case, then there's a real opportunity for us to go back to the drawing board with that.
I'm going to take somewhat of the easy road and echo what Key just said in terms of the values. A lot of these programs were made well, now it seems like a really long time ago, given the past 6 months. But the values were potentially different then. We didn't have as much data to inform what was actually going on. And I think it's time for us to reevaluate some of the values in our programs and what we really want for families. And I don't know how you do that in the context of federal law that's been passed and the kind of challenges of getting new laws passed at the federal level, but maybe even potentially reevaluating the rules, the regs, to see what changes can be made without necessarily opening up some of these big laws. I also just think it's really important that we focus on outcomes, and that's kind of my big takeaway from this conversation, is that the states are focusing on outcomes to a large degree, and we figured out which data we need to inform those outcomes, while we also are meeting our federal reporting requirements. So to the extent the federal government becomes outcome focused, I think the better off we're all going to be. So that's my aspiration, both of those things.
David or Christina?
Yeah, I think it's been really interesting to hear that everybody at one point or another today has used the word values and talked about how we've had to re-examine our values at the state level, and then we're pushing for the feds to look at their values in the context in which we're operating. And so I want to echo that. I would say it's really baseline level. I think it's been brought up a number of times today, but just having a shared definition so that all programs are using the same words for the same things would be incredibly helpful. When federal agencies are working together and have to get really creative in doing so, you'll understand the challenges for us and how creative we've had to get in working together. So yeah, I want to affirm all of that. But then also, yeah, absolutely, just a values discussion. Are we measuring what we need to be measuring at this point, or do we know more? And how does that inform the conversation going forward?
Thanks, Christina.
I yield back most of my time.
Thanks, David. And I'll hand it over to Catherine to close us off. Thanks to all the presenters.
Thanks, everyone. I've